Bismillahirrahmanirrahim. Thanks to International Brain and Biomedicine Conference for giving me the chance to present the online oral presentation. The topic of my presentation is effectiveness of buspirone in ameliorating nicotine-induced addiction and related neurological deficits. My name is Dr. Saiqa Tabassum and I am representing ZABA's Department of Biosciences, Karachi campus. First of all, we start with the introduction. As my topic is on nicotine, so nicotine is found in the tobacco, in the leaves of the tobacco plant, that is Nicotiana tabacum, and it also serves as a cholinergic nicotinic agonist. It is a CNS stimulant, and due to which its property, it serves as an addictive compound in the central nervous system. And when we using nicotine, there are a number of deficits that it will exert on the body. There are numerous deficits which will be harmful for the body. If we see the impact of nicotine on the brain, then we found that during the normal neurotransmission, acetylcholine serving as a neurotransmitter in the brain, and acetylcholine esterase enzyme is breaking it. But when we taking the nicotine, so neonicotinoid compounds are formed in the synapse, that due to which acetylcholine esterase unable to act on it, and due to this acetylcholine receptors become blocked and leading to paralysis in the body. In regards to the nicotine addiction, there are treatments available for the nicotine addiction. Two types of therapies will be prescribed for the nicotine addicted peoples. One is the nicotine replacement therapy and another one is the non-nicotinic options. Nicotine replacement therapy includes the patches, lozenges, nasal sprays, and gum, while the non-nicotinic options include the use of antidepressant drugs. Buspirone is a first azapirone class of anti-anxiety drugs that does not produce any tolerance or physical dependence or any side effects, and it does not interact with the benzodiazepine receptors or any GABAergic neurotransmission. That's why it will be considered a useful drug, particularly for the treatment of generalized anxiety disorder. If we see the impact of buspirone on the brain, then we found that it is a 5-HT1A full agonist at the presynaptic neuron, and this buspirone is the partially agonist also at the postsynaptic 5-HT1A receptors. So it can act on both the presynaptic and postsynaptic. Since buspirone is used for the anxiety, but the literature has also showed that buspirone has an impact on treating the addiction symptoms as well. Researchers show that buspirone has an effect on the cigarette withdrawal symptoms, on the apomorphine and morphine regarding addiction symptoms, cocaine addiction, and also it reduces for the nicotine, but its effects has been monitored only on the monkeys. So, keeping in view these all researches, it can be that the buspirone has an additional efficacy in treating the addiction. So, based on this rationale, the research problem is that will be targeted in the current study is that the co-administration of acute buspirone will be able to reduce the reinforcing and addictive effects of nicotine. So the objectives of the current study is to observe the potential of the buspirone treatment in preventing the addictive effects of nicotine in rats, and to analyze the neurobehavioral changes and the associated biochemical, neurochemical, and oxidative changes in rats. For this, we have taken the 24 rats and divided them into two groups, control and nicotine. And then these all rats two groups are further divided into two subgroups of saline and buspirone. For the methodology, the overall work will be completed in almost 2 weeks, and in the start there is a acclimation period, then the preconditioning assessment done of the rats, then the drug is started from the day 2 till day 14 on alternate basis along with the conditioning in the CPP operators, and then along with this buspirone treatment is also continued. After the day 14, the behavioral analysis and post conditioning CBP testing was done, and then rats were decapitated for their biochemical and neurochemical analysis. For the behavioral analysis of the addiction-like symptoms, condition-based preference test was used, while for the rest of the behavioral analysis, we have used the open field test to study the exploratory or locomotor activity, concealer inverted screen test to address their muscular strength, elevated plus miss test to address their anxiety, a force swim test to determine the depression-like behavior, a novel object recognition test to determine the recognition memory, Morris Watermaid test to judge the spatial memory abilities of the rats. After that, for the biochemical analysis, we have analyzed the levels of glucose, total protein, cholesterol, urea, and triglyceride and creatinine in order to observe that whether there has any side effect of the buspirone or not during the treatment. For the neurochemical and oxidative analysis, the content of the acetylcholine, GABA, and lipid peroxidation inside the brain has been observed. The results show that if we see the addictive performance of the rats in the condition-based preference test, so we observe that the buspirone-treated rats as compared to the nicotine-treated rats has a significant prevention and the addictive symptoms. While the rats who has taken the nicotine plus buspirone, they continuously prevented the addictive symptoms in both the vehicle paired and drug paired box. So this confirms that the buspirone has a potential in reducing the nicotine addictive effects. If we see the open field test operators, so we have observed that the buspirone does not has any negative impact on the exploratory and locomotor activity, while the nicotine has the adverse effect on the exploratory activity. If we see the inverted screen test results, so we found that the muscular strength was reduced upon the treatment of nicotine, although it's not significant. But when we treated with the buspirone alone or along with the nicotine, so there is no adverse effect or decline in the muscular strength. Similarly, in the elevated plasma test, if we are observing the anxiety levels, so we found that buspirone, as it's an anti-anxiety drug, so it has reduces and elevated the anxiety-like symptoms. So there is no anxiety-like symptoms. While in case of nicotine, there are anxiety-like symptoms. In case of forced swim test, we observed that after that there are depression-like behavior have been reduced by the use of nicotine plus buspirone and as well as with nicotine too. In case of memory, if we are seeing that, so surprisingly, we found that nicotine plus buspirone treatment is useful for the memory of the rats as well, particularly for the cognitive memory, as the sniffing time for the new object was increased after the treatment of buspirone plus nicotine. And if we see the special memory abilities, so we found that the special memory abilities also has a difference as compared to the control in all the three groups in nicotine and buspirone plus nicotine group as well. If we see the biochemical results, so we have not seen very much difference after the treatment of the buspirone or nicotine. So we found that there is no impact on the glucose and total protein levels, as well as regarding the cholesterol and triglyceride levels. So we found that after the treatment of nicotine, there is a slight increase in the cholesterol level, but it's under the control range, and the buspirone has reduced this incline in the cholesterol levels. If we see the urea and creatinine levels, so there is not any adverse effect has been observed. So all the levels are under the normal range. And if we see the brain neurochemical analysis results, so brain acetylcholine content has been observed to be increased in the nicotine plus buspirone group as compared to the control and the buspirone group. If we see the GABA results, so GABA levels are reduced in the when we are using the nicotine, but when we are using the nicotine along with the buspirone, so we found that this impact of nicotine on the GABA levels has been elevated. And if we see the oxidative analysis in the brain, so we found that the lipid peroxidation levels were increased following the treatment of nicotine, but buspirone, when using along with the nicotine, so it has ameliorated this effect. And if we observe the catalase level, so catalase enzyme levels were reduced after the treatment of nicotine. But when we are using the nicotine plus buspirone, so the levels are trying to be restored, but they are not that much restored as compared to the control. So finally, we can conclude it from this study that the buspirone has a beneficial impact in improving the neurological deficits that are caused by the nicotine addiction. So nicotine buspirone has could be able to decrease the nicotine addiction and can be used a useful treatment for the treatment of addiction and for elevating the addictive symptoms in future, as along with treating the anxiety. So we have an additional therapeutics for the buspirone. At the end, I'm thankful to my university, Zabist, and my collaborating institute, University of Karachi, for providing me the support and for their collaboration and for their financial assistance for executing this work. At the end, I'm thankful to IBBC team for giving me opportunity to present my work. Thank you.